It is on record that the nation is losing over 1,200 people to kidney and urogenital diseases every year. My figure might not be right. I just talked to the CEO, and he says, Minister, Korle Bu alone. I said, no, nationwide. He says, it is likely we can have even more. Again, a lot of resources are sunk into flying people outside the shores of Ghana for treatment of acute nephrology cases, and it is only fair that this project is done, and done very well, to save lives and save resources of our country. There is still a long way to go in achieving the desired specialist facilities that the country deserves. But government is not resting on its oars. We have come a long way in building our healthcare infrastructure through successive governments, but the gap remains huge and still needs to be filled. The biggest challenge, however, facing the ministry is the reluctance of prospective health workers to serve in facilities outside the big cities of Accra, Kumasi, and to some extent, Takoradi. This problem is further compounded by parents and relatives who come up with several stories hoping to effect changes after postings. Let me serve notice, Mr. President, with your indulgence, that this phenomenon will no longer be countenanced as the country stands the risk of losing out on the achievement of the much talked about universal health coverage. Mr. President, yesterday I had an occasion to ask a very close friend who was coming to me to try to change the posting of relative. And I told him that the president is going to build hospitals across the country. So if our children, our nephews and nieces should all come and work in Korle Bu and Range, how will we get doctors to go to those places? So I seriously am working on discouraging all of us who will come and say, they have been posted to OT, but I want to come to Accra. So President, the sad thing is that close to 82% of all doctors in our country are found in the environs of Accra and Kumasi. And so we have places that I call the one hospital, one doctor syndrome. So the doctors in such facilities are working 24 hours and rest for 365 days a year. They can't even go on leave. Some don't have doctors at all. Government has taken steps to improve the incentive packages for staff posted to the rural and less endowed areas. And I'm encouraging all of us to see ourselves as Ghanaians and work wherever we are posted. You never know where you will need medical help. It is my hope that we will all put our hands to the wheel and drive our health sector growth in the right direction.